So, hernias can come in various different types. So, one of the most commonest types in males is what we call as a groin hernia, or in more specific medical terms, it's called as an inguinal hernia. So, basically, if there is a swelling or pain in the groin, we call it as a groin hernia. Similarly, by location, hernias can be of various different types. So, if you get a hernia in the belly button, it's called as an umbilical hernia. If you get a hernia in a previously operated scar, that's called as a ventral hernia or an incisional hernia. Similarly, you may get a hernia in the upper part of your tummy called as an epigastric hernia. Although the types of hernia are different depending upon the location, the treatment is kind of the same. And more so importantly, we need to understand what happens if one leaves a hernia alone, or what if it's left untreated, because many a times many of my patients come and ask me, I don't have any pain in that particular area but I have a swelling, do I really need to get operated? So basically, as I told you, hernias, you have a protrusion of your intestine that's coming through that defect, and if the hernial content or the intestine stays in the hernial sac outside the area where it should be, or rather outside its home, which is internally, now it can lose its blood supply over a period of 4 to 6 hours, and that can cause serious problems, and that could lead to life-threatening conditions. And doing a surgery for a hernia as an emergency has multiple problems, especially on a patient who's elderly or has multiple comorbidities. Rather than planning a surgery for these patients in an elective manner, you could do it by minimal invasive and laparoscopic methods. Thank you.